Bruce McIntyre is a father and the founder of the Save a Rose Foundation. It is named after his longtime partner, Amber Rose, who died during an emergency C-section in April of 2020. And since then, he has dedicated his life toward advocating for Black people and other people of color facing discrimination in healthcare settings. Bruce, thanks so much for joining us today. Oh, I think we're having a little problem. I don't know if we can hear your audio. Bruce, can you unmute yourself? Do we have you there?
Oh, thank you for
There we
having
go.
me.
Hi. Well, thank you so much for sharing your story with us and your partner's story as well. That was last year. Talk to us about how you are doing today and the advocacy work that you have done over the course of the last year.
I'm still fighting every single day, and I'm finding strength in my community and, advocating for families. That's really helping me in my grief. I feel like, I really don't want anybody else to have to face the inequities that I've had to face and, the struggle behind that. And I want to, help families out as much as I can.
And Bruce, these numbers, as you know, through the work you've done with your foundation, they are jarring. So let's talk about some of these statistics here. The CDC says nationwide, African-American women are 3 times more likely to die from a pregnancy-related cause than white women. Now, locally, a report from the New York City Health Department finds it's actually worse. They've found that African-American mothers are 12 times more likely to die from pregnancy-related complications. So, Bruce, talk to us about some of the reasons for why this is and how things like racism and implicit bias actually play a huge factor here.
Well, so what we see in a lot of our communities and our underserved communities is we're seeing that a lot of these hospitals are being so substantially defunded. And in order for them to make up, they're, performing things like C-sections. When the statistics show that over 60% of these women don't actually need the C-sections if, they're being treated properly. But as we're seeing today, we're not getting the care that we deserve. We're not getting the standard of care. We're seeing that some of these hospitals are, it turns into a surgical issue. And now that it becomes this surgical issue, they're making about $8,000 per person versus what they would a natural birth.
So you've done a lot of research and you've done a lot of work over the course of the last year. What kind of changes and steps have to be taken at this point to create a more equitable healthcare system?
Well, what we need to be seeing is we need to redirect the course of birthing equity, and we need to fund midwifery-led birthing centers where we're seeing better birthing outcomes, and you're being treated before, during, and after pregnancy, as well as, being treated through postpartum. And we need to see insurance providers covering this. This is why we need universal health care.
And in a lot of cases, we know that the care and resources are there. It's just that they are denied to certain people. Bruce McIntyre, thank you so much for being with us, and we appreciate all the work you're doing.
Thank you.